Seeing an unrest at one of the hospitals belonging to the Nelson Mandela Bay municipality. This is not, the only one of its kind in this municipality. It's particularly over the issue of PPEs and the lack of testing, particularly among staff members from the Department of Health. We have seen before the Doranginsa, Livingston and a clinic in Zwide engaging in a similar protest, especially with Zwide very recently mentioning that one of the main issues was the fact that there were 11 people who had tested positive and the staff did not feel safe. That protest particularly resulted to the closure of the hospital. But in this incident, we have heard, or it has been reported, that 2 people have died in this particular hospital because of COVID-19. And as you can see, there is quite a number of people protesting, particularly staff members who say that they feel they are at risk, with some of these people protesting here awaiting their results after getting tested and having been told when we got here that there's quite a number of them who have not yet been tested and who are awaiting a COVID-19 test. But let me remind you that the Eastern Cape currently stands at 1,356 cases of COVID-19, with the Nelson Mandela Bay accounting for over 500 of those cases and having 8 deaths under its name. But we are going to speak right now with the Regional Secretary of Nehawu, Sweetness Stokwe. Ma'am, a very good morning to you. Can you just tell us briefly what is this protest, mainly about?
The protest is mainly about PPE and many other issues, shortage of staff, because there was a promise that the department claimed that they are ready. So we thought that they will prioritize the issue of appointing people. There is a great shortage of staff. There is a PPE issue whereby yesterday we have discovered that there is a PPE in the hospital, but we are shocked and disappointed that our members are not provided with the right PPE. For an example, a porter who needs to transport a patient who is positive or who is a suspect is expected to be given a proper PPE. But this management of this hospital thinks that it is proper to only give them masks and gloves. And we are against that. 2, there is also an issue of racism in this hospital, victimization of our members, whereby you are told that you are going to nurse a patient that has COVID. If you don't want to, you are expected to resign. And we are saying that it cannot be correct, because our view is that there must be a risk assessment. Last night we came here because yesterday 2 members, officials, were removed in this hospital. The CEO and the head of nursing were removed by workers after department failing to come here and intervene. So last night we felt that let us come here to also do a random visit, check the night shift. We left this morning at 2 a.m. where we discovered there is no soap in this hospital, where people will have to degem and sanitize. People are subjected to buy their own sanitizers. There are members who are chronic, who've got heart disease, people who are pregnant. They are forced to nurse patients who are positive. And now in this region, we are committed to work with the department. We have said that. And we are committed in our members serving them, because they believe that these are their brothers, these are their parents. They don't have a problem nursing them. But what they cannot do is to risk their lives. And our view as a union is that it cannot be correct that you say that someone who is supposed to be nursing this, you are not safeguarding, because our understanding is that these people, their safety should be prioritized, because as a country we rely on them to nurse our people who are facing this infection. And we must say that we are disappointed that this management of this hospital has been undermining the stakeholders in this hospital, whereby you will know that initially Livingston was the one who was identified as a hospital. We later learned that there are people who are being admitted here. We said we don't have a problem, but consultation must be done so that we prepare our members. But over the weekend, we've seen that the whole hospital has admitted people who are COVID. Hence, you see this thing, because now there is no longer a dedicated ward. It's a whole hospital, and last night we have proved that. Thank you.
And can we just talk about the 2 deaths in this hospital? Can we talk about the 2 deaths in this hospital? You mentioned earlier on that, those people have been handled by various people who could have risked being infected. And you also mentioned that, it was sad because the staff members and the porters that were handling those particular patients had been tested but are still coming to work, saying that, you're actually saying that they are at work rather, and you would have preferred it if they remained in isolation and more people tested.
Yes, that is our view, that if our members test, they must be in isolation or quarantined. They cannot be expected to come here and report to work, because remember, the results may come back saying that they are positive. And our view as a union is that if these members test and they are expected to be here, there is a high risk that they are transferring the disease to the community. That's what has happened as Zwide, where nurses tested positive and they've been demanding to be tested and they were expected to continue working. Hence you see that Zwide community has a high rate in terms of numbers, and that's what we want to avoid here in Utnik, whereby people who have contact with patients, when they test, our view is that they must sit at home up until their results are confirmed. And in this hospital, they are being threatened to come to work and perform duties while they don't know their status, and that is wrong. Hence we have a view to say that now as a union, if this engagement that is going to take place here, because we see members of parliament, if we do not see any positive outcome, we will go to the law. Law must take its course, because this hospital is not complying in terms of the regulations.
Thank you so much, ma'am. That was the Regional Secretary of NEHAU, Sudnes Dokwe, saying that they have been experiencing, a lot of inefficiency from the Department of Health, particularly the Utnik Provincial Hospital, saying or complaining about the fact that staff members who have tested or who are awaiting their results are expected to report for duty and continue working, which imposes risk on other people, particularly staff members and additional patients. She says that, she would appreciate, or they would appreciate it if, for an example, the meeting that is held here or being held here today will yield or might yield positive results, where more protective gear might be supplied or will be supplied, and also staff members will not be expected to continue working despite having tested and not really knowing where their results or how their results stand currently. But right now, from myself and Nqonji and my colleague Natasha Magundulu, it's back to you in studio.
And Natasha, thank you very much indeed for that report.